Hi, this is Paul Howell, Managing Editor for Healthcare Asia magazine, and today I'm presenting the Healthcare Asia Awards for 2021, celebrating all the best projects and initiatives from hospitals, clinics and specialty service providers from across the Asia-Pacific healthcare industry. Winning 2 awards in this year's presentation was Reem Hospital in the United Arab Emirates. It's won Home Care Initiative of the Year award and also the Specialty Hospital of the Year. I'm joined now by its chairman, Zaid Al Siksek. Zaid, thank you very much for being here and congratulations on the awards.
Thank you. Thank you for the consideration. We're very proud.
Well, congratulations again. Can you start by telling us a bit about the home care programs that you initiated during the pandemic? What made this such a successful undertaking?
Thank you. The program and the hospital was in its infancy stage. And we took the opportunity to really support the government and support the initiatives that were happening across the UAE, generally speaking, in Abu Dhabi specifically. And one of the major undertakings by the government was to really drive the ability to provide home isolation and home quarantine for a lot of the COVID patients. And we engaged in a very professional manner by putting together our teams and putting together what we call the pathways and processes that are associated with being able to deliver safe, right quality, and also the efficacy of our program in dealing with these type of patients. And what was great about the program that we undertook was, number one, the speed at which we were responding to the requirements of government, and two, in being able to keep the customers happy around, testing in time, reporting in time. As you know, with the pandemic, I think a lot of people had a lot of challenges around being able to get, number one, cleared quickly. Number two, they wanted to know their test results. And number three, they wanted the ability to be able to talk to someone at any one point in time. So I think we were able to really drive a program that was, generally speaking, quite efficient, but also very effective in the way we delivered the care to those patients.
Now, what were some of the challenges that you encountered during the development and the implementation of this initiative, and how did you go about solving them?
So there are quite a few challenges, as you could imagine. I mean, with the pandemic, generally speaking, and with the shutdowns that were happening, I think, being able to navigate across town and across the city became quite a bit of a challenge, being able to find the clinicians and caretakers that would actually be frontliners and would take the risk, knowing that these patients suffered from the pandemic or suffered from COVID, was always a big challenge. And I think, they are heroes, as a lot of people have been describing them, being on the front line. And we were so proud of the team taking the risk to save other people's lives and also to support the government and the various health system stakeholders. So I think the challenge was multifaceted. Like I said, the first and most important element of it was the human capital side. Number two was the logistical requirement, being able to deploy, be it the cars, be it the routes, and getting to those patients in the fastest way possible. And three, the reporting, i.e., no IT systems have been so-called built in the past for such a pandemic. And so being able to adopt those IT systems, being able to use the tablets live and on-site to report the patient's results was always a challenge. The last but not least was being able to make sure that our lab tests were accurate and were timely. Was quite a bit of a challenge, and it ended up working out quite nicely once the routine or sort of the process became more common, and as we took on more volumes. But because we were efficient, one of the other challenges was that the government began to depend on us even further, i.e. they referred more patients to us. And so the volume challenge became a bit of an issue. But, we stood our ground. We did what needed to happen or what needed to be done in order to make sure that we continue to support the program to the extent that we have. And Reem Hospital really stood out, one, from the management team capability, but two, and the ability to work with stakeholders in a very flexible manner. And as a young organization, I think that's always a challenge, being able to remain flexible and not to be too rigid within your decision-making processes. So I think a lot of that really helped Reem Hospital to stand out.
Overall, what's been the impact of the pandemic on your hospital, and how have you and your staff been able to cope during the crisis?
So clearly, like any other hospital, I think that the pandemic puts a lot of pressure on resources, mainly human capital resources. But not only that, the ability to continue to provide services to patients in an effective way, and also be able to be flexible in the identification of the wards and the spaces that are to be isolated versus provided for the regular patients. So there's been a considerable amount of pressure, but generally speaking, we've almost had to live with it, and we've been living with it for over a year now. Early days were much harder than it is today, but today we're thriving, and we've been able to really sustain the capability to, one, keep a safe environment within the facility, ensure that our staff continuously test and take accountability and responsibility around ensuring that they provide effective care, and also making sure that patients are always safe to the extent possible. Reem Hospital has stood out to be able to, one, take on some of the volumes from government providers who are also the first line of defense, and being a private entity, I think supporting the government providers by taking on some of the volume constraints that they have, being that they're the front liners, or the front line of defense with regards to COVID patients, was also very, very good in terms of an experience. One, we learned to, private and public providers collaborated more with one another, created systems with each other, and really shared a lot of resources. There was one common goal, one common objective, and that is, really to combat what we needed, combat this pandemic, and really try to support these customers and patients in such a tough time.
What's been the most fulfilling part of doing all of these programs and initiatives? And have there been any key learnings during the development of them?
Look, I think the social responsibility. Healthcare is a social service. At the end of the day, providing that responsibility towards number one, the patient, and we always say in our industry, the patient comes first. Number two, the stakeholders, and I think having really got the support and provided the support for the various stakeholders was a very key element of our value proposition, and also our positioning, and also accountability. So we took on a very important role. To our viewers, I would say, look, in healthcare, quality comes first, and providing value-based healthcare is what it's really all about. It's not just about saying we've got good quality programs, but it's also showcasing those programs in such tough times, and really being able to stand with the various stakeholders, starting with the patient, and also being able to provide the internal support. So the alignment among your staff, the alignment among setting systems and processes, and the importance of technology, right? So technology was a very big enabler in our programs, and in this line of defense, and helped us tremendously. And I think the way forward is to really take on more technology in a way where you could drive telemedicine solutions, where you could really engage with patients from a distance. And I think that really disrupted the way we provide care, and also has disrupted the way the health system takes technology into consideration. So I think the pandemic has really set a new era of healthcare delivery, and we think we're at the front line of taking advantage of that, and really helping to support our service provision through that technology.
And what's next for your hospital? Where do you see Reem Hospital heading over the next 5 or 10 years ahead?
So we, Reem Hospital, are hoping to be, the best hospital in town, and maybe for the region. Our ambitions go far and wide. We really are very keen on driving quality and transparency as part of our fundamental pillars of healthcare delivery. We want to be transparent with regards to outcomes. For our patients, we really would like to drive quality as our number one target and focus on the patients. I think that this transition, or I guess this recent engagement in regards to COVID has been an extremely eye-opening experience. The experience has helped us to be humble around, the importance of healthcare for the community. It's impressed upon the importance of quality. It's impressed upon the importance of being able to work as one unit with regards to our teams, our doctors, our nurses, our technicians, and last but not least is really being able to engage around driving this in the next couple of years. So you asked me, what do we hope to be in 5 years? We'd like to be the hospital of choice for the community at first hand, but also be able to really drive a change within this market in terms of how we believe healthcare should be delivered. So we're relatively new in the market, but we think we've got bigger ambitions than our competition.
And finally, Zaid, what does it mean to you and your team to have won at this year's Healthcare Asia Awards?
To be recognized through the awards has been a phenomenal experience. Like I said, we're a new entrant into the market, and to be recognized at the stage that we're at is great recognition, not for me, but for my team. And I think that the team has been really pleased to be recognized. And I think, in such tough times, a little bit of recognition goes a long way. And so we think that these awards are a great way of representing, 1, 2, recognizing, and 3, really, keeping the ambition going and the driving force to continue to seek other awards going forward. So we hope to get some more after this experience.
Zaid Al Siksek, thank you very much for joining me, and congratulations once again.
Thank you so much.